Here I will go over the mechanism of pathogenesis of neurofibromatosis type 1 and type 2 and then discuss their clinical symptoms. So first I will fill in this table and then in the end I will summarize all the findings. So both neurofibromatosis type 1 and type 2 are autosomal dominant disorders. Neurofibromatosis type 1 is caused by mutation in the NF1 gene, which is located on chromosome 17, and it codes for a GTPase activating protein that decreases the expression of RAS proto-oncogenes. Patients with mutation in NF1 present with café-au-lait spots. And café-au-lait means a hot coffee that is mixed with an equal amount of hot milk. So these patients present with hyperpigmented macules that would increase in number during childhood. And here is an example of a café-au-lait spot. So a hyperpigmented macule. In addition, these patients present with axillary and inguinal freckling. So typically there would be freckles anywhere that there are skin apposition, and thus there are usually freckles in the neckline as well. In addition, they would develop Lisch nodules, which are hematomas that are present in the iris. So here are Lisch nodules that are a good diagnostic tool for neurofibromatosis type 1. And finally, these patients present with neurofibromas, which are peripheral nerve sheath tumors that are made of Schwann cells mixed with fibroblasts. So the final condition is neurofibromas. I would also like to mention that neurofibromatosis type 1 may be associated with optic gliomas in about 15% of the cases, and with pheochromocytoma in about 5% of these patients. The next condition I'm going to talk about is neurofibromatosis type 2, which is due to mutation in NF2 gene that is located on chromosome 22. And NF2 gene codes for the protein called merlin, which is a tumor suppressor protein. And so these patients will present with tumors of the nervous system, the most common of which is bilateral vestibular schwannomas. So bilateral vestibular schwannomas. So these schwannomas usually occur in the cranial nerve 8 at the cerebellopontine angle. So here is an example of a bilateral vestibular schwannoma at the cerebellopontine angle. So cerebellopontine angle, as the name implies, is between the cerebellum and the pons. So here we have the cerebellum, and then here is the pons, and then the tumor is right in between the angle of the cerebellum and the pons. Now these patients, due to these tumors, present with tinnitus, hearing loss, and balance dysfunction. I would also like to mention that patients with neurofibromatosis type 1 may develop cataracts. Actually, 60 to 80% of these patients will develop cataract in early childhood. So now I would like to summarize all these findings. Neurofibromatosis type 1 is caused due to mutation in NF1 gene, which is located on chromosome 17 and codes for a GTPase activating protein that decreases the expression of the RAS proto-oncogenes. These patients present with café-au-lait spots, axillary or inguinal freckling, Lisch nodules, as well as neurofibromas. 15% of these patients present with optic glioma, and 5% present with pheochromocytoma. The next condition is neurofibromatosis type 2, which is due to mutation in NF2 gene that is located on chromosome 22, and it codes for the merlin protein, which is a tumor suppressor protein. And these patients present with bilateral vestibular schwannomas that is usually in cranial nerve 8 at the cerebello-pontine angle. And thus they present with tinnitus, hearing loss, and balance dysfunction. And about 60 to 80% of these patients will develop cataracts in early childhood. And that concludes our discussion.